Assalamu alaikum. I am Dr. Marfia Arjumand, lecturer, Department of Biochemistry. Today I will discuss on iron metabolism. In our RBC, the main component is hemoglobin. Hemoglobin consists of heme and globulin. Heme consists of iron and protoporphyrin. So, the iron content of body is 4 to 5 gram. Now, we have to know what are the sources of iron. Iron present in two forms, heme iron and non-heme iron. Heme iron, we get heme iron from animal source, that is egg, meat, fish, and we get non-heme iron from plant source like green leafy vegetables, cereals, pulses. We have to know how iron is distributed in our body. So, iron is distributed in our body as hemoglobin, it is 60 to 70%, ferritin and hemosiderin, it is 25 to 30%, and ferritin and hemosiderin, this is the storage form of iron. Myoglobin and intercellular heme containing enzyme 5% and plasma iron with transferrin protein 0.1%. So, now what is ferritin? It is the storage form of iron. Reticuloendothelial cells of bone marrow, liver and spleen, iron binds with a protein called apoferritin to make ferritin. One apoferritin can bind with 4,300 iron atom. Hemosiderin, this is also the storage form of iron. Ferritin molecules coalesce or degrade to form hemosiderin. In storage site, 2/3 ferritin and 1/3 hemosiderin. Transferrin, found in plasma, iron binds with protein transferrin and make iron binds with protein apotransferrin and make transferrin. Okay. Now, what are the active form of iron? So, the active form of iron is ferrous form. This is biologically active, can pass through cell membrane, found in hemoglobin, myoglobin, heme containing enzymes. Inactive form, ferric form, found in ferritin, hemosiderin and transferrin. Now, how iron is absorbed in our body? So, when we take food, we get the ferric form of iron. This ferric form is converted to ferrous form with the help of gastric hydrochloric acid and vitamin C. This ferrous form is absorbed in the intestine, or they may store as ferritin in enterocyte. Again, then they again absorb to blood and transported as transferrin, then again stored in different organ as ferritin and hemosiderin, or they may contribute to synthesis of hemoglobin and myoglobin. Routes of iron excretion. So, iron is excreted through discommission of skin, through fecal route by discommission of intestinal epithelial cell, through menstrual loss in female. Now, what is the RD of iron? That means recommended dietary allowance. Adult male 10 to 20 milligram per day, adult female 15 to 30 milligram per day, and pregnancy or lactation 40 milligram per day. Factors regulating iron absorption. Iron demand of body and mucosal block. Mucosal block is the mechanism by which intestinal iron absorption is directly regulated at the level of intestinal mucosa by the body need of iron. State of body iron store, state of erythropoiesis in bone marrow, gastric hydrochloric acid and other reducing agent, example vitamin C and form of iron. Okay. To see the iron status in our body, we do some lab test. Serum iron profile. So, the components of serum iron profile are plasma iron concentration, serum ferritin concentration, serum transferrin concentration, total iron binding capacity and transferrin saturation. Okay. Now, what are the causes of iron deficiency anemia? Hookworm infestation, malnutrition, repeated pregnancy, chronic blood loss like piles, menorrhagia, colorectal carcinoma, subtotal gastrectomy, achlorhydria. Now, the laboratory features of iron deficiency anemia. So, here plasma iron concentration low and transferrin saturation low, and serum transferrin concentration, total iron binding capacity high and serum ferritin concentration low. Okay. Now, causes of iron overload: hemochromatosis, excess parenteral iron therapy, multiple blood transfusion, ineffective erythropoiesis, example thalassemia. Now, what are the consequences of iron overload? Hemosiderosis, hemochromatosis. Now, this is the laboratory feature of iron overload. Here, plasma iron concentration, serum ferritin concentration and transferrin saturation high, and serum transferrin concentration, total iron binding capacity low. Okay, this is all about our today's class. Thank you all.